Hello, welcome to Dr. Ties, your medical expertise whenever you want. Please note that this is strictly for educational purposes and not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Today I will talk about the causes and treatments of urinary tract infection or UTI. Urinary tract infection or UTI may involve the urethra, bladder, kidneys or ureters, which are the tubes between the bladder and kidneys. Infection of the bladder is known as cystitis. If the infection involves the urethra, this is called urethritis. The common symptoms of UTI are pain or burning sensation while urinating, urinary frequency, cloudy urine, needing to urinate more urgently, lower abdominal pain, high temperature, and rarely blood in the urine. If the infection is higher up or in the kidneys, there could be pain in the back where the kidneys are located. If the urine is dark color and has an unusual odor and there are no other symptoms, this could be due to dehydration rather than infection. This can easily be managed by drinking plenty of fluids. The main cause of urinary tract infections is bacteria that enters the urethra from stools. Since the urethra is shorter in women, the risk of infections is higher in women. If the bacteria move higher up in urinary tract, it can cause cystitis in the bladder and kidney infection in kidneys. There are certain factors that can increase the risk of UTI, and these include sexual intercourse, pregnancy, kidney stones, enlarged prostate in men, weak immune system, diabetes, urinary catheters, dehydration, and poor genital hygiene. There are urine test kits at pharmacies that can be used to check for the infection if there are any doubts. If the symptoms of UTI in females are quite mild, over-the-counter remedies such as cystipurin, cystoplus, Hyprex or azo urine infection medication can be tried first. Plenty of fluids including cranberry juice can also help clear the infection. The effectiveness of these is not clear and they may be more effective at preventing the infection rather than treating it. Paracetamol can be taken if there is pain or a high temperature. More severe symptoms of UTI require treatment with a course of antibiotics. It is recommended to see a doctor in person if it is the first presentation of urinary tract infection, if the infection affects a child, man or pregnant woman, or if the symptoms return after treatment. Kidney infection can present with a very high temperature, blood in the urine, back or kidney pain and confusion. This type of infection requires urgent assessment and treatment. Children with urinary tract infection can have a high temperature, vomiting, bedwetting and can look unwell. Children with these symptoms should be taken to see a doctor for early diagnosis and appropriate treatment. UTI can be prevented with simple measures. It is advised to wipe from front to back when going to toilet to prevent the bacteria from entering the urethra. Good genital hygiene, washing the skin around the vagina with water before and after sex, and urination after sexual intercourse can also help. It is recommended to drink plenty of fluids to prevent dehydration, which can increase the risk of infections. It is best to avoid scented soaps and tight synthetic underwear as these can cause irritation leading to infection. Excessive amounts of alcohol can irritate the bladder, and sugar can encourage bacteria to grow, so these should be avoided. It is recommended to use condoms and a diaphragm with non-spermicidal lube to reduce the risk of infection. If there is history of recurrent urinary tract infections, D-mannose and cranberry products can be beneficial, although the evidence is not strong for these, and they may not work for everybody. It should be noted these contain a lot of sugar, and cranberry products should not be taken if on warfarin medication. Urine culture tests may not always pick up the infection. The decision to start antibiotics is usually based on whether someone has symptoms of urinary tract infection. So, if someone has symptoms of infection and has normal urine test and culture, they may still require treatment with antibiotics. Chronic UTI may require long-term treatment with antibiotics and a referral to see a specialist doctor.